Of course, we talk about water-related disasters. And this could not just go from anything from flood and drought to even to lack of course, you know, when there is drought, people don't even have water to drink. In certain villages, it is said that when people finish washing hands, they have to keep that water for something else. They don't pour it away like you do, because water is such an important and even in some areas a scarce commodity. So key target areas, again, there's need for international collaboration to be able to achieve and support and strengthen developing countries to be able to do what they need to do to stay good with water. So some of the challenges of the SDG number 6 and its actualization come 2030 is limited access to clean water and sanitation. So it's one thing to have access to water, but it's another thing to have access to clean water. It's also one thing to have access to sanitation, but it's a different ball game to have access to hygienic sanitation. So those are some of the challenges that the SDG will face, and how much coverage has been achieved so far is a big question. Poor sanitation and open defecation is still prevalent across the world, especially in the developing parts of the world. Water scarcity and unequal distribution, of course, we talk about unequal distribution as inequalities and inequities. And this unequal distribution of resources and even of water or water resources or related resources can be modified by human intervention. And so in those areas and places where human intervention is denied deliberately or by negligence, then we're really concerned and worried. So climate change impact, of course, most people know about the COP28 that just concluded in Dubai. Climate change is a big deal. It affects water, not just the availability, but the quality of the water. And it could even affect how much of SDG number 6 is achieved come 2030. Of course, water pollution is a great deal. A lot of chemicals, a lot of environmental degradation. Contaminants leaching from the sewage systems and all over, and even the chemicals that are used in agriculture and all those kind of stuff, beginning to mess up even the little water bodies that we have, polluting the water sources, and then exposing human beings to all kinds of danger. And even some of the cancers that we have today could be attributed to all kinds of water pollution from all kinds of chemicals, some of which are not even fully yet understood by scientists. Challenges again continue: lack of infrastructure and investment within this space. Population growth. I already talked about inequalities and inequities. We talk about poor governance and poor lack of political will by the ruling class. Some of these are challenges that are facing the SDG number 6. So, but again, with all these challenges, there are also opportunities. So the opportunities are now left for us to leverage, and we could take up some of these opportunities by innovative thinking. We should be able to monitor, generate data, use data to make decisions, and monitor progress based on available data. Unfortunately, in most places of the world, you don't have data. They don't even have any data of how many people had reported with diarrhea, for example, in a local hospital in the last year. You'd be surprised that in most of Africa, you can't even have those kind of data. Makes it difficult to be able to monitor water and water-related issues that we have in the communities. Public awareness and education. These are opportunities. And these are some of the reasons that we are doing what we are doing. Public awareness and education is important. If the people understand what is going on and know what they need to know and see where the gaps are and begin to act in line and with the vision. More than likely, we could be able to make some progress. Public, private,
Can anyone hear me? Not yet.
Yeah, I think the speaker lost his connection, and
let's get him back. I'm sure he must have logged. He's out of the call. All right, I will see you lost. I think due to network issues, I'm sure he's coming back just in a minute.
network of passion.
Okay, I think he's back. Okay, getting back as a co-host. Okay, here we are.
Okay, I apologize for that break in transmission. Can we hear me?
Yes, we can hear you perfectly,
Hello?
sir.
Okay, so sorry about that break. My internet is a little fluctuating here. But I was talking about the opportunities that we still need to take advantage of to be able to achieve the SDG. And now I'm talking about the strategies. Some of these strategies have to, again, be cooperation and collaboration, both international and intersectoral collaborations will help. Now, there is a need for preparedness against disaster that could happen. It could be flood, it could be drought, even some epidemics, outbreaks, and stuff like that. I talked about equity, the need for equitable distribution of resources to address the need in those areas that are worse off. Policy, strategies, and reforms will help to also address those concerns, especially in some of the neglected areas. I spoke about data, the need for us to generate local data and to use data to monitor and progress and to drive policy and to inform management on the operational, the tactical approach to addressing some of these challenges at the local level. Because every strategy has to be operationalized within the local community, taking into cognizance their own peculiarities. And of course, we have to build capacity to be able to address. I talk about community engagement, but not just engagement, but community ownership. If the community is engaged, but they don't take ownership of the project, chances are, and we have seen in places where they vandalize the project. Of course, we have to keep up with the latest technologies and not be advanced technology while we are trying to. Strategy is important in achieving this. And some of these strategies have to be localized and customized based on those local communities and community peculiarities. Education and awareness, very important. PPP projects are encouraged. And then, of course, to build a very resilient water system that is both environmental friendly and economically active. Overall, I have tried to do a quick overview of some of the areas of interest and things that we need to address in this discourse if we have to really achieve SDG number 6 come year 2040. We have always said that waterborne diseases, and not just waterborne diseases, but all issues around water quality, negative tropical diseases, even if it is a drought, anything that has to do with and sanitation and hygiene can be achieved if we join hands and make them happen. This is the right place, and we are trying to keep the water discourse in the fore to make sure that all hands are on deck as we gear towards 2030 to make SDG one of those that was SDG number 6, one of those that could be achieved, or at least that will advance in its stages. Thank you, and I hand the mic over to the moderator.
Okay, just a minute. Okay, thank you very much, Dr. Okolo. the CEO, Rite Group, for that presentation. Of course, collaboration is one of the strategies we can actually use to achieve the goal 6, which is clean water and sanitation for all. We are now going over to our special guest, the founder of Network of Water Rights Initiative, Mr. Chukwuemeka or AK. So if you're here, you can unmute yourself. I'm going to ask you a question about what, to tell us about Network of Water Rights Initiative and what you are doing in this space, especially in terms of achieving the Sustainable Development Goal 6, which is clean water and sanitation for all. So I would like you to give us an overview, because this dialogue, as a matter of fact, is actually a strain and actually reaching out to especially those working in the water space to understand what is going on in communities in Africa, because it's important that we know, because you cannot really solve a problem without knowing alone. Of course, there's a lot of people who are in this space, contributing their quota around this space. So I would just like you to give us an overview of what Network of Water Rights Initiative is doing, and in respect to SDGs, the challenges, the opportunities, and of course the strategies that you take into consideration while taking action in this particular goal. Thank you very much.
Thank you very much, Bona. Just to thank you for the introduction. Just to say that there's a whole lot packed into what you just said about discussing the challenges, discussing the opportunities, the strategies. It's a whole lot to unpack in these 3 themes that you've mentioned. But as much as possible, it's not something we can discuss in one session. It's not something that we can exhaust in just one sitting. But like you rightly mentioned, I'm just going to highlight 1 or 2 things that the network is doing to be able to improve access to clean drinking water and facilitate achievement of the SDG 6. First, I would like to actually thank the Right Place Health. I was excited seeing the topic and the area at which that the organization was actually focusing on. As a passionate wash advocate, I've over the years tried to advocate for access to clean drinking water for citizens. That's the basic thing that every citizen should have access to. And interestingly, for the length of years I've advocated for this cause, it is on a rare occasion that you see an organization focusing on water quality. Now, the stage at which we are at the moment is we are struggling to even get the water. So most Nigerians are concerned about, can we even have access to water? We've not gotten to that stage of saying what is the quality of the water we even have access to. And so when it comes to clean drinking water, it's still a mirage for over 60 million Nigerians. And so when I saw this topic and I saw what you are doing in terms of bringing the issue of water quality to the front burner, I was actually impressed and excited, and I was happy to come say 1 or 2 things about what we are doing in that regard. And so kudos to the team at Right Place Health. Just a brief information about the Network of Water Rights Initiative. It's a network of non-governmental organizations that came together to actually promote and enhance access to clean drinking water, sanitation, and hygiene services. And in doing so, there are two key approaches that the network is adopting, which is the human rights approach and the responsibility-based approach. Now, if you look at our structure in Nigeria, the federating structure which we operate under, when it comes to water supply, the mandate to give people access to clean drinking water lies with the states. And so the state governments are the ones mandated to actually supply clean drinking water to its residents and citizens. The federal government does not have any role to play in terms of direct supply of water to citizens. They only play the oversight functions at the federal level. And so the onus is basically on our state government to get this clean drinking water to its citizens. And that's why the Network of Water Rights Initiative, what we are doing is engaging state governments, because that's where the bulk of the work is. If the state governments are able to give the people the water, the clean drinking water that is part of their mandate, then we won't have cause to worry about the federal, because the federal only does an oversight function. And so, at Network of Water Rights Initiative, while we advocate and engage with the government, at the same time, the citizens also have a role to play in this cause to improve access to clean drinking water supply. And the role of citizens are very much as important as the role of the government, and that's why we are adopting that's why we are adopting a responsibility-based approach in our advocacy, and also adopting a human rights approach in our advocacy. And so the citizens have the responsibility to play. That's where the responsibility-based approach comes in. And where the human rights approach comes in is the fact that access to clean drinking water and sanitation is a fundamental human right. This is a UN resolution, which Nigeria is also a treaty to that resolution. And so recognizing the fact that access to clean drinking water is a human right is which must be respected by every mandated authority, be it for those where the federal government are responsible, and for those where it is state governments that are responsible. And so respecting that human rights is something that is very dear to us at Network of Water Rights Initiative. And so in instances where you have where you have millions of residents and citizens not having access to this clean drinking water supply, what you are having at that point is violation of their human rights. And so we are coming from that angle of the government, letting the governments know that when they deny people access to clean drinking water, what they are doing is violating their human rights. And this is a resolution that you as a government signed. It's part of the UN resolution that you signed, that Nigeria signed. And coming down to the states, most states have water laws. And within those water laws, they also recognize that access to drinking water is a human right. And so we can't have all this on paper, and at the same time, you still have millions of Nigerians struggling to get access to clean drinking water. And basically, that is this is just a preamble, a background to what we do at Network of Water Rights in trying to engage both the government and the citizens. I can go on and on about what we do in the field, but I think it will be more, to guide our discussion, it will be more appropriate for you to probably respond to specific questions when you ask them. Bona.
Okay. Thank you very much, Mr. Temple. I would like to, you said access to clean water is actually a fundamental human right based on what your organization is doing. I would like to, and you also said that access is a problem. We are talking at the right place. Beyond access, we're talking about the quality of water that people drink, because it's also it's a problem, because not just having access, you might have access, and the quality of water that you're drinking might end up, having also other issues, which are diseases, and so I actually want to know, I know you are someone who is actually based in Enugu, most of the works, the network of water rights doing, they do more in Enugu, of course, from my knowledge, you can prove me wrong. What is the level of access, to water in Enugu right now? Of course, I know you made reference to the government. I know water in Enugu has been a problem, especially in the city center. And the new government came up with the fact that one of their campaign slogan was the fact that they want to fix the water issue in Enugu, especially the urban. So what is the level of access in Enugu? Because we're most interested in, small communities, states in Africa. How are they, what assets, will they have the access as well? And before we even talk about the quality, in as much as we're much more interested in those who have access already, the quality of water they do. So what's the level of access to clean water in Enugu as it is now? What can you say about that?
Okay, thank you very much, Bona. So Enugu is has a peculiar situation. And that's why most of the work we do started from Enugu State. For decades, Enugu has been plagued with perennial water scarcity, and this issue is something that is man-made. It's an artificial water scarcity. It's not. It does not have anything to do with the fact that Enugu is the topography of Enugu, or the fact that there is coal underground in Enugu State. That is the excuses that governments over the years have come up with to be able to get the people to believe that water scarcity in Enugu is a natural thing. But we have come to realize that it is artificial, it is man-made, that Enugu is actually blessed with abundant water resources, both surface water, rivers, lakes, and groundwater as well. And so when it comes to water availability in the state, it's something that the state is blessed with. The challenge the state has been facing in terms of giving water to the people is the fact that less attention has been paid to the infrastructures that will supply this water from where they exist to the citizens or the residents of Enugu State. And so over the years, it's been residents of Enugu have resorted to giving themselves or providing themselves with their own water supply as against the government with a mandate to give the people water doing that. And in Enugu State, from the survey we carried out, we realized that in terms of getting drinking water supply in homes across Enugu, people rely mainly on the sachet water. And I can bet you very few persons even bother about the quality of the sachet water that they consume. And when it comes to water for domestic use, now majority of residents in Enugu also rely on water tankers, what you call water tankers. So they are the major water service providers in Enugu State. That is not to say some of them don't also drink the water from the water tankers. They also do in cases where, considering the cost of the sachet water and the likes that they depend on. And so it's been an issue for most homes in Enugu State to have access to clean drinking water, because from the government, that's when I say clean drinking water, I'm trying to say for most homes in Enugu, access to pipe-borne water is still something that they only can imagine and not experience. the state has a water board that's been mandated to actually supply water to the citizens, to supply clean drinking water to the citizens and residents of Enugu metropolis. But at the time we had an assessment, we did an assessment of the water supply situation in Enugu State in collaboration with the Ministry of Water Resources as well. We realized that just less than 10% of the population in Enugu metropolis have access to pipe-borne water supply. And this number, the people that actually even have the access, they get to see the water run maybe once in 2 weeks or twice in a week. So it's been epileptic in that way. And for a city where you know that that the access to clean drinking water is something that would definitely increase or boost the GDP of the state. There are several companies that could have come to Enugu to site their businesses, but just getting to know or listen that to get the information that if you get to Enugu and you site your company there, then you need to probably look for your own source of water supply. And because it is difficult to, in most of the places in the city, it's difficult to just come and drill your borehole and you get water. You have to either rely on the water tankers or you rely on the state's pipe-borne water, which is almost non-existent. So relying on water tankers to run your business is very cost-intensive or capital-intensive, and you would rather not site your business in Enugu just because of that reason. And so it's something that has been driving business away from Enugu State. And interestingly, this has been happening until this government came to power and decided to focus to address the issue. And in addressing the issue, they gave a timeline as to when they would actually see that there is water running in homes of residents of Enugu State. The governor, as part of his campaign promise, actually cited 180 days from the time that he's going to be sworn in. And they got to work immediately they were sworn in to actually fulfill that promise. And what they did was basically the same thing that we have been clamoring for, the same thing that we recommended to the previous government, to say you have abundance of water supply in 9 Mile, which is very close to the city, Enugu metropolis. Why not harness the potential of that water supply in that area, or water resources in that area, and recirculate it to the city so that people can have access to clean drinking water supply? This recommendation we gave to the previous government, and they started something. They started rehabilitating the water works or water scheme in that location, but they didn't complete it. And so when this government came in, we also went to them as well to to also pass the same information to them, to say if you're determined to actually meet up with your 180 days timeline or target that you set, then there's need to complete the 9 Mile water scheme. And that was what this present government did. They were able to rehabilitate that scheme, completely rehabilitate that scheme, and not just rehabilitating, they actually upgraded the capacity of the scheme so to actually get more water from that location. And but that's not all in terms of their promise. The promise was to get the people homes to have access to pipe-borne water. And so completion of the 9 Mile water scheme was just the first step to meeting that target. But unfortunately, that was the only thing they could do within the 180 days. The other issues, which is the fact the recirculation, the transmission of the water supply to houses or to homes of residents in Enugu State is something that they have just commenced or started doing at this point, which as a network, we are also following up with them to see how far they can go with that. But the challenge or the fear with that is that when the government gave the promise and the 180 days got the timeline elapsed, the government actually was focused on the fact that they've met the target that they set, which in the real sense is not what it is. And so we were worried that if the government is saying that they've met the target, meanwhile, the people are not getting water in their homes, there is that skepticism that they would just leave or end their efforts in what they've done, which is to rehabilitate the water scheme at Nice Mile and just get the water without reticulating it to homes where it would be useful. And so we decided to also engage them in terms of reticulation and in terms of transmission of this water that they've been able to produce. And so this is what presently we are doing with the government to see that they don't take their foot or their feet off the pedal in supplying Enugu residents water, clean drinking water, so that the people can at least enjoy their human rights, which is access to clean drinking water in the state, and as well boost the GDP of the states. Because when people get to know that there is access to actually pipe-borne water in states, then businesses can thrive and new businesses can as well come into the state. I think I can stop here, and if there's any other info or any other questions, specific questions, I can respond to them.
Okay, thank you very much for that expose. It's more like giving us idea of what's actually happening in Enugu, because we want to narrow this down to real communities, real conversations as it affects the people, because that's what we're actually talking about there. So I will actually open this line to our CEO to see if he has questions to ask you, based on the conversation, the things you have said. And after that, if we have people in the call who have questions, you can also maybe put these questions on the chat box, so that after the CEO has our interface, we can now look at these questions and answer them. And after that, we'll wrap up. Dr. Mezie, over to you, sir.
Thank you, Temple, for that insight into some of your activities. Like you said, we cannot exhaust this discussion in one sitting. There's a whole lot to unpack. Even if we just sit down with the challenges of achieving SDG number 6, that will take us a whole discourse by itself.
Yeah.
So every of these topics can be a whole discourse. But my question would be, given the activities of the initiative, the network, and knowing that 2030 is around the corner, is SDG number 6 achievable in Africa? And if no, what can we do different to be able to at least approach it, in your opinion? Thank you, sir.
All right. Thank you very much, Dr. Mezie. I think 2030, the target is 2030. And the aim is to have universal access to clean drinking water supply and sanitation, and as well as hygiene services for all, without leaving anyone behind by 2030. And so we might decide not to even take the global, let's not even look at the global trend or progress that's been made, because at the moment I can say we are totally off track in meeting that target. Globally, with about 2.1 billion persons still struggling to actually have access to clean drinking water, you can agree with me that it's a tough call to say within the next 6 years this number of persons will have access. Considering put into consideration population growth as well, meaning you might even have more than what you have now not having access if the right things are not done. And in terms of doing the right things, there is a whole lot that each and every one of us can do in terms of pushing to meet this target. You highlighted some of them during your presentation, which was very, very important, very key. One of them was monitoring and data and monitoring as well. Having data for informed decisions, and also putting in place monitoring systems to check progress within states and across countries as well. So when it comes to monitoring, which is something that I'm actually very particular about, there is this how do I put it? There is this belief that a lot of funds are being channeled into the water sector, but the investments or the funds being channeled into the water sector globally is not reflecting in terms of the infrastructures that are on ground to actually get water, clean drinking water to people. And so that is where the non-governmental organizations come in to serve as there's a whole lot of work for non-governmental organizations or passionate advocates in the water sector to actually place more emphasis on accountability and transparency in the sector. Now, this is one thing that I think would yield very huge results for the sector globally, or in Africa and also in Nigeria. So when you talk about accountability and transparency, it's something that we are yet to get right in the country. So I'm using Nigeria, for example. The fact that the responsibility or the mandate to supply or to provide clean drinking water to people is the prerogative of the states or of the government means that most times what we get or what we see in the country or in states is that the governments have decided to use water projects as almost persons that would want to either provide water or provide clean drinking water to citizens, knowing that it's very important. They use the water projects as conduits or conduit pipes to siphon funds from the economy. And so this is something that needs to be checkmated by the non-governmental organizations in the sector, placing much emphasis on transparency and accountability in the sector. We close a lot of loopholes that is derailing the sector from meeting its target. And so there are so many other things that we can do, but whenever I am opportune to talk about the situation, I am always keen on highlighting just this one area of intervention, which is accountability and transparency in the sector, and not being biased in terms of other things that can be done. I would always want to just stick to this intervention and to this area of intervention and enjoy or urge every other person to look into going into this particular area of intervention, because it's a whole lot of results that we can get if we're able to boost transparency and accountability in the water sector.
Oh,
over
sure.
to you, Bonaventure. Yeah.
Okay. Yeah, I think let me the CEO is out, but I'm sure he's getting back to the call. And I would also like to say you have actually said a lot in this based on the question they asked you. And so I don't know if there are other people who have questions while we wait for the CEO to come back. His network is having a little issue. And if you have questions, if you have to raise your hands or if you have to type your question on the chat box. So we're focusing on our focus on SDG number 6. Okay, I think our CEO is back. Dr. Mezie, I don't know if you have still have questions or based on what he said, if you have something to say.
Well, I think like we already said that this discussion is going to be an ongoing one, because there's a lot of questions to be asked and there's a lot of engagement to be done if we can even go anywhere near achieving SDG number 6. In Kigali conference, we also, one of the papers we presented is SDG number 6 achievable? And we're going to post that somewhere on our website, so people can have access to it. And the answer we gave in that conference is yes and no. But the reality is, it is probably more no than yes. Given all the challenges and even where we are right now, and the number of people that still need to have access, and all the things that need to happen for access to come. My concern is what Temple said, that a lot of the discussion so far is still around access. Nobody is talking about quality yet. You have to have water before we talk about how good is water is. But then the problem with that also is it even okay to have access to poor quality water? Or is it better to not have water at all and drink Sprite like I did in August? Again, I leave that question for us. But I have had an opportunity to drink Sprite instead of water, because my friend said, you can't drink this one. This is diarrhea waiting to happen. And so a lot of people are daily exposed to diarrhea waiting to happen in what we call sachet water or bottled water within the system. And when bottled water is called diarrhea waiting to happen, how much more sachet water? And so if those of us who are able to afford bottled water are not even sure of what we drink, how about the lesser water? And this is serious. It's a serious issue that we are dealing with. But before I know who else has a question, let me ask Temple. Temple, a lot of your network, can you tell us a little more about the kind of the size of your network, the spread of your network, and how well your network is doing, or what can we do to help the network do better with its mandate?
Okay, thank you very much, Dr. Mezie. So our network is a national network, but it's with a membership base of over 20 grassroots organizations at the moment. The focus, most of the members are actually located in the southeast, and majority are also in Enugu, because that's where we started from. In terms of what we are doing and where definitely there will be need for synergy, the fact that that's actually what gave birth to the network. The fact that we realize that it's not something that just one organization can do. And so there is need to bring together several organizations that are passionate about the same cause to champion the cause itself. And so collaboration is something that is key to what we are doing at the network. There's a whole lot of ground to cover. There's a whole lot of things to also do in that regard. And so when it comes to opportunities for collaboration, looking at the aspect of water quality that you've rightly mentioned, it is something that we are yet to start talking about. I can tell you that as part of what we are doing presently in Enugu State, we are already looking ahead in terms of believing that the government will supply water, will be able to finally get water across to the citizens. And so we want to start looking at what would be the quality of the water that we'll be supplying. How can the citizens also have a say in terms of the quality of water that they are going to be supplying to them? At the moment, we are carrying out a research on citizens or residents' knowledge, perception, and their response to industrial water pollution in the state. This is what we're doing at the moment to get data that would help the government make informed decisions in terms of the quality of water, surface water bodies across the state at the moment. So as much as that research is going to give us this very important data that we needed, there's also that aspect of campaigning or advocating to end open defecation. Because what we see is that open defecation is also adding to the poor quality of water that you have across the states, because the water bodies have eventually become dump sites for waste, and not just solid waste, and fecal waste as well. And one critical question you would want to ask is, in states like Enugu State, where you have the fecal sludge evacuators, that is those tanks, those people that come to evacuate the soccer waste when they are filled up, has anyone asked where do they dump the waste after they leave their homes? You might be surprised as to the outcome or the findings that you would get when you decide to ask such question and go into that area. And so these are the things that we want to also put a stop to. And then, but for us to do that, we need data. We need reliable data that would guide our advocacy and also help the government to make informed decision in that regard. And so this research angle is where I think organizations that are also interested in water quality should also come in. So that's, yeah, I think I can stop here for now. And definitely, there's a whole lot to discuss. Like I said, please, we might not be able to say everything in this meeting.
All right, Mr. Temple. We have like 3 minutes to go from this call because we promised that this call is going to be 1 hour. And yeah. I will just give the mic to Emmanuel Acha. Please, 30 seconds, just ask a question or contribution you're going to make, because in the next 2 minutes, we're out here. You can unmute yourself now, yes.
Thank you so much, brother. Of course, let me congratulate the organizers of this program, or this workshop today, and for the job well done. And also to thank the facilitators for a very well insightful presentation. Mr. Temple, you've done a very great job in what you're doing. Let me start with a question. The ED Act, is SDG number 6 achievable? I can say yes or no. One is that yes, in the sense that, of course, when we're talking about the global north, where things, visions or dreams like this are being carried out, out, being committed to implement. We can say yes, in those areas they can be achievable. But when you are talking about global north, south, which is Africa and some part of the Asia continent, is not achievable. And why is this not actually possible? Because of the fact that everything boils down to leadership. What kind of leadership? What do we have, especially in Africa, in Nigeria particularly? The kind of leadership we have determines the kind of commitment of that leadership to achieving the SDGs, especially when we are talking about the SDGs number 6, which is very, very critical to the survival and to the development of the country. Now, let's talk about the issue of water in Southeast, water problems, water challenges in Southeast. I think part of the challenges we are having is that there's no continuity of water project in Southeast. For instance, I'm aware in Ebonyi State, I think about 2 regimes past, they came up with a water scheme called of water scheme in, I think, in Ikwo local government area of the state, which is meant to serve the entire state. But unfortunately, there's no continuity. Okay, even the Enugu we're talking about, I'm also in Enugu. I know that the Temple's organization has done a lot of advocacy with respect to engaging the government on how they can address the water problems. And I didn't start in this regime. So, and thank God, there are a lot of gains that have been made in the past. But you knew what it took for them to even arrive at this point. And nothing much. We can't say that water is running efficiently in Enugu State. They are still having that much problem. So in the water issues. So my point is that there's need for continuity, there's need for visionary leadership, and we should take a regional approach to addressing the water problem in Southeast, because almost all the states in the Southeast cities are having the same issues with respect to water issues. Now, the advocacy groups should also be able to open up the opportunities for a lot of advocates to participate in those groups, because this is something that requires a collective effort. A lot of people, we need a lot of voices to speak up on these issues with respect to addressing the challenges around water problem.
Okay.
Thank you.
Thank you very much, Mr. Emmanuel Acha, for the insight. Of course, we said that this is a continuous conversation. We might not be able to exhaust, but if we keep talking about the challenges, opportunities, the whole year, we will have something to say. Thank you very much for that insight. Thank you very much, Mr. Tempo of Network of Water Rights Initiative. I would like to hear your last advice based on SDG, achieving SDG 6. And after that, I will also give the mic. That's in 1 second. I'll also give the mic to our CEO to give a closing remark while I wrap up this conversation. Thank you. If you are here, Mr. Tempo, just a second. Your last word on this.
So I'm just quickly going to say, retrace what the last speaker said. Synergy is key. Let's continue to collaborate and synergize. That's the only way we can amplify what we are doing. No organization, no single organization can get this done. Without synergy, there is little or less that we can do. Thank you.
All right, Dr. Mezie, over to you, sir. He said something about synergy. I'm sure you mentioned something too. If you are here, sir.
Well, right place synergy. We'll be happy to synergize with everybody in this space. So it's a pleasure to have you all on this call. Again, right place synergy and right place health are involved in water quality and access to water by all, or clean water by all, to achieve SDG number 6. So I would invite us to visit rightplacehealth.org to see some of our programs And I want to use this opportunity to let us know that on August 21st and 22nd, we're going to be having an international conference that is called Rite Place. And the theme of that conference is going to be Beyond Access, Quality Matters. Beyond Access, Quality Matters. And we'll be looking at ensuring safe water distribution in Africa. And so mark your calendar, August 21st and 22nd, and all roads will be leading to the NAV conference here in Abuja to be discussing this. And we hope to bring in all the key players within the water quality space in Africa to see what we are doing and what we can do to achieve SDG number 6. Again, thank you, Temple, for being our guest today. Our doors are wide open. We'll be more than happy to collaborate and to synergize with you and your initiative and your network to see what we can do within this. It's our pleasure to have you all. Thanks.
All right, thank you so much, Dr. Mezie. And thank you so much, Mr. Tempo, for coming to this call, and every other person that have participated. I'd like to tell you that Right Place Health is open to collaborations in any way in relation to what we're about. Waterborne diseases can be eradicated in Africa, and let's join hands to make this happen. And on behalf of the Right Place group, I want to thank everybody, especially for being on this call. Just like our CEO said, we'll be having a conference in August, and we'll be also be sharing more details about this conference, what is about water beyond access, quality matters. So this is going to involve several countries in Africa. They'll be coming to Nigeria, and we'll continue even. Our dialogue continues. Of course, we're looking out for other people who are actually, doing something in this space, and we want to do it together to make sure that by 2020, even if we don't achieve that, but we must have made a significant stride, especially in terms of our own country, Nigeria, and other countries in Africa. Because if we have clean water, some of the diseases that today threaten the existence of some of us in our communities and wherever we stay will be a thing of history. So thank you everyone here. The Right Place Water Quality Dialogue continues, and of course we will inform you whenever the next edition comes up. And I also want to tell you that we're open to collaboration. We are ready, to work with anyone in this space, and by so doing, we can achieve the SDG number 6. So thank you everyone for coming. Of course, this video will be up on our YouTube because it's streaming live, and we hope that people will watch as well and have maybe input or whatever they have to say about the water dialogue. Thank you so much and have a lovely day. Bye.
Bye. Thank you.
Thank you, everyone. Bye-bye.